All right, it is Wednesday, and that means it's time to answer some common medical questions. Joining us now is News Channel 5's medical specialist, Dr. David Soria. Good afternoon.
Good afternoon. How are you, Keith?
I'm doing great.
Good.
He is the Chief of Emergency Medicine at Wellington Regional Medical Center. We're glad you're here with us. We're going to get right down to it. Can gas cause chest pain?
We get this question a lot, and it absolutely can cause chest pain. I mean, what is gas? Well, it's a swelling of the intestines, and what can happen is that swelling can push up against the stomach, push up against the diaphragm, and cause pressure, nausea, symptoms like that. Also, it can cause reflux or spasm of the esophagus. So it can definitely cause pain in the chest and radiation in the arms and into the neck. Problem is, there's a lot more serious things that can cause the same type of presentation. For example, a heart attack, pressure, radiation. You get short of breath, a little nauseous, and it can last for only short periods of time as well, just like gas can. So the one thing I definitely do not want you to do is if you're feeling pain in your chest, don't chalk it up to gas, especially if you're over 40 or you've never had it before. I absolutely want you to call 911 and come see us in the emergency department to get it evaluated. Delaying it or blowing it off can absolutely cost your life. Don't want you to do that. Feel chest pain, come in and see us.
Now you say it's a pressure in the intestines, but that happens to a lot of people. They get gas in their chest when you drink cola.
Sure.
Or anything carbonated. So is that the same thing?
It absolutely can be, although that's typically more inflation of the stomach itself, which can also cause pressure. So either one can mimic pressure in the chest, but again, I don't ever want you to blow that off, even though it seems simple and, you know, leave it to me to turn gas into something deadly, but the reality is you got to always think about it, especially if you've never had it before.
Okay, I'm going to bend down and grab a little prop here. We always talk about drinking water. Here's my little water thing that I bring. This is 24 ounces, so we hear 8 glasses, which would be 3 of these a day. How much water, though, are you supposed to drink, and how do we calculate that number?
Yeah, well, you know, water really comprises the majority of your body. You're about 60% water, and it's very important to the vital organs and how they function. And even mild dehydration can cause you to feel sluggish, a little tired. And there is sophisticated equations that we can use to calculate how much you should drink. Problem is that they take a lot of things into account. How much you weigh, the minutes of your workout, how much you exercise, where you live. Is it dry? Is it warm? Is it cold? Do you have a fever, diarrhea? Are you pregnant? All those things are factored in. But you know what? It's unnecessary. You don't need that accurate of a number. The reality is, general rule, 2 things. One is 2 liters a day is about what the average adult needs, which is about 10 glasses, 8-ounce glasses of water. Remember, it's not in addition, it's total fluids that you take in for the day. But another general rule is very simple. The color of your urine. If your urine is straw colored, then you have enough hydration. If it starts getting too dark, then you're probably starting to get a little dehydrated. It doesn't need to be clear, just straw colored. And that gives you a very good and accurate indication as to the hydration status of your body.
All right, so look before you flush.
Okay.
Okay.
Exactly.
Nothing wrong
Good
with
call.
it.
Good call.